Youth civil organizations in Eldoret have vowed to make sure mental health information is availed to youth in Eldoret to reduce the rising number of suicide cases among the youth. The mental health needs of children and adolescents in low and middle income countries have been neglected, leading to a serious mental health gap. There are insufficient numbers of professionals trained to provide mental health care. The World Health Organization reports that mental health care problems affect 10 to 20% of children and adolescents worldwide. They also estimate that half of all mental illnesses begin by the age of 14.
We know that a lot of mental illness has onset at early age, and we see about 60% of the people who actually develop mental illness develop it at a very young age. So it's very important that we are doing something, especially about prevention and promotion for these young people, so that if there's anything that can be done to delay or even stop altogether the development of mental illness, then we are able to do it.
The focus on how best we can bring young people on board so that when we are drafting these policies, when we are having these conversations around mental health, and the people who are affected the most are actually in that room. For instance, we cannot say that we are factoring in young people and we are having policies that support the mental well-being of young people without necessarily having those young people in that room, like drafting those things with them. We are not saying that we want to do it alone. And we're also not asking for the people who have gone before us to do it alone. What we are asking is, how can we best collaborate? And that's what exactly we've been advocating for.
The interventions that we develop also are interventions that can be taken up, because when we develop the interventions without involving them, then chances of them being embraced are going to be very low. That's why it's very important to engage youth. But we also know that in this day and age, there are many risk factors for mental illness, especially among the youth, and one of them is social media. And in the course of discussing risk factors for mental illness, and we discuss social media, then our hope is that youth are going to get to a point where they can use social media, because social media is not necessarily evil, but it's what is done there that can be harmful. If you're going to compare yourself negatively, if you're going to be bullied because of the things that you're sharing, but people are also comparing themselves, so they're not content.
An idea that I would like to put across, maybe begin a new curriculum in schools, introduce mental health in schools to help them learn about coping styles, how to deal with stress, among others, and to advocate for mental health everywhere, because most people keep assuming that mental health is just another thing that is not amongst them, yet they don't know they are actually suffering from different mental health cases.
To think that most of these cases that affect the students and pupils in primary and secondary schools are all as a result of mental health issues, and introducing mental health to the curriculum will be of great help.
Some of the issues that affect the youth that lead mostly to mental health is